Okay, we're recording. So today, is really going to be a fun Q&A, just talking about hair health and hair loss. We all have it, believe it or not. But I think I happen to be a woman in menopause age, and I've really seen a big difference in terms of just how much hair I have. So if you're a woman, that's a very normal thing. But Dr. Salazar is going to go through hair loss, hair health, what we can be doing to get our hair growing again. So let me introduce you to Dr. Salazar here. Wait, my little slideshow will cooperate. It's frozen. Sorry, my screen is frozen. So, well, then I'll just go ahead and introduce Dr. Salazar, and I'll try to get us back to that slide. So Dr. Salazar is a board-certified plastic surgeon, and he's been with our practice now 2 years, but has been in Houston and in San Diego as a plastic surgeon. He's a fellow of the American College of Surgeons, and he's a board-certified plastic surgeon. And he, for hair, is really our resident expert because he's the only person in our practice that does hair restoration, and we have multiple levels of hair restoration. So he trained side by side in Houston with Dr. Alfonso Barrera, who is one of the world's most highly respected hair transplantation experts. And Dr. Salazar has a very high patient rating. His patients absolutely adore him. He has an overall rating of 4.8 out of 5 stars, which is really, just speaks to his level of professionalism and expertise. And, here at LJCSC, we're known, one of the things that makes us special, we really have the full spectrum of options. So, some places you might go, they only have one device for helping you with hair. We have multiple solutions, from non-surgical things that he'll talk about today, supplements, hair care products, all the way to hair grafting, which really enables us to customize the need to your needs, your goals, and your budget. We are one of the first practices in San Diego to have smart graft technology, which he'll be talking about today, which gives us, just a faster healing time and not a lot of interruption in your lifestyle. So he'll talk about that as well. So I'm going to go ahead and stop sharing my screen and open it up to Dr. Hector Salazar. Are you there?
I'm right here, and I've been listening carefully. Thank you so much for that introduction.
It's all you. I think it's back to you.
Very good. Can you hear me?
Yes.
Perfect. So thanks so much, Monique, and we're really happy to have this forum so we can share with our patients and with patients in general, even before they become our patients, our approach, our holistic approach to hair restoration. We think that hair loss or even hair thinning is a common problem in a general population, and it's not a problem that only affects male patients. Also, female patients can develop this hair thinning or even hair loss. And the way we like to approach this problem here at La Jolla Cosmetic Surgery Center is with a very comprehensive evaluation of our patients. As you were correctly saying, we have a big spectrum of treatments that actually range from something that's very non-invasive to a little bit more invasive treatments with more dramatic results, with more powerful results for patients that actually require a more involved intervention. Hair loss problem, I feel that every day we are more and more aware of different areas of our health, including hair, that can be dramatically impacted by leading a healthier life, and paying more attention and not accepting things that we take for granted. If we start having some hair loss, we just at a certain age, sometimes we might think that that's normal and that's expected, and then we don't do anything about it. I think that day after day, in modern times, we are truly paying more attention to those small things in life that can boost our well-being, can boost our image and our overall health. And hair is one of those areas. I feel that that hair restoration we can all benefit from hair restoration. People with hair loss problems or people with hair thinning, we can all benefit from a good advice in terms of what can we do to get our hair, our head looking at its best. And today's session, I actually would like to make it a little bit more interactive, more instead of after I share a little bit my philosophy about it, to get some questions from the audience, or some questions that, or some points that you, Monique, want me to touch base on or go in a little bit more depth. So to tell you that when you visit our practice, what we would do is we would look into all the different factors that can be potentially affecting your hair, such as lifestyle, such as genetic components, such as different habits that we would have, or different hormonal stages in life that you might be going through, and try to approach the problem in that way so we can find different solutions. Other thing is we would classify the severity of the problem based on different scales that we have, and then that way we would be able to find a good solution. We have a great maintenance programs in terms of things that can help you on a day-to-day basis. We actually have products for hair restoration from hair restoration laboratories that have very, very good shampoos, conditioners with natural ingredients that would not cause any harm to your hair, to your scalp, and would actually boost your hair, would give them a better shining, a more natural look, and a healthier look overall. We also have a good vitamin nutrition supplement that will ensure that you would have all the oligo elements, all those micronutrients that your hair needs to be at its best. And we have those supplements. We approach them in different categories according to your gender and according to your hormonal status. In addition to that, we have other topical solutions such as minoxidil, 5% minoxidil preparations, also to help boost and stimulate hair growth of follicles that are dormant actually, and that are being affected by hormones. Also, in addition to that, we have other approaches such as PRP, and that's we'll talk about maybe in the Q&A session in more depth about how this treatment works. But the PRP is a natural solution that you have inside your body, circulating all the time in your bloodstream, and that we obtain, we hyper concentrate, and then we inject it in your scalp directly to boost that hair, to give you healthier follicles, and to wake up those dormant follicles that, even though they're alive, but they're not shooting a nice hair shaft that you can actually see. So that's a good way, another way that we have to improve your hair. And then finally, to go into some hair transplantation, in which what we do is we literally, there's no secret about this, we cannot generate new hair or create new hair or get it from somewhere and put it in you. So what we can do is we can actually harvest it from areas that it's rare for patients to develop some hair loss, and steal it from those areas and redistribute that hair in different areas that you might need to either get an enhancement or to actually restore from scratch, where you actually have zero hairs and you need to get more fullness in those areas. So we also have some promising, in the near future, we're going to be working with a very good device that I'm pretty sure our audience is familiar with, hydrofacial. But I mean, who has ever received a facial of their scalp? I mean, it's even though it sounds a little contradictory, but it's just like the facial treatment that you get for a facial with cleansing, exfoliating, but we apply those principles. And pretty soon, of course, when we're back in our med spa, we were going to be offering treatments with this new technology from Hydrofacial, it's called Keravive, and it's truly a facial of your scalp, in where we can cleanse, we can exfoliate, and we can also stimulate and nourish your hair with the use of very, very new technology by applying 5 different growth factors and 2 peptides that will help your hair growth in a much, much healthier way. So we have plenty of tools, plenty of different solutions for everybody. And truly, I would invite patients that are interested, or potential patients that are interested, or already established patients of our practice. We see many of those patients stopping by and visit with us, spend a good hour of their time over here with us, chatting about their hair, looking into all the different options, going over several slides that we have in terms of education, and also in terms of results of our different techniques and strategies.
Great. I think that's a super thorough overview. And so I think what I'll do is I'll share my screen, and because I do have a couple pictures of your, and I found your slide. I think it's working.
Yeah, I think it's important for us to share some of those some of those results. Oh, we can already see in the screen now my introduction. Yeah. So just to very good. Yes, that's correct. I'm a member of the American Society of Plastic Surgeons and the Aesthetic Society as well, and I'm a board certified plastic surgeon. So some of the let me share with you with the audience a picture of a patient that actually received a PRP treatment. So PRP, as I was telling you, is basically obtaining a concentrated plasma that it's rich in platelets. And to translate this, whenever you get a small cut and you start getting some bleeding, you hold some pressure on top of that area, and after a couple of minutes, you take a look and the bleeding already stopped. And that's the reason for that. It's because the platelets actually started working, and that platelet activation triggers the entire healing process. And if we can get all those proteins and growth factors concentrated that are already in your plasma and inject those locally, inject those into your scalp, what we achieve are 2 different things. One is that we improve the blood supply, the blood flow to the area in general, and better blood flow, healthier hair, more nutrients into the hair. And in addition to that, as I was telling you, along the hair cycle, and we can go over that once if a patient comes and visit our practice, you will see that you have a certain number of hair follicles dormant. You have those follicles that are alive but are not actively shooting hair, and those are the ones that we can recruit with PRP. If you go back to the first picture, you can see, especially in the temple area, on the temporal parietal, that's how we call that area over there where you have your arrow, and you can look at the difference between the before and after. You can look how the hair looks thicker, looks fuller between one and the other picture. If you can go to the next slide, it's not that she's growing hair everywhere or it turns into a very hairy person, but look at that. Look how right in the middle, you can compare and see that her hair is thicker and fuller. And if you go to the posterior or occipital projection, you can see how that those what I like to exactly those areas right there. What I sometimes tell patients to try to visualize how these results are expressed is, imagine that you're in a helicopter and you're trying to land, and where is it easier to land, on the left side or the right side? Definitely the left side has more clear spots where you could potentially be landing than on the right side. And the other thing is, as I was saying, it not only increases the number of active follicles that are shooting hair, but also it creates a better and healthier hair shaft. And that all of our patients that have received PRP treatments, they immediately say, I mean, they give us a call after a month of the first injection, and they immediately say, there's something going on with my hair. It looks and feels more healthy. The same thing is expressed by their hairdressers. They immediately say that they notice something different on their hair. And this is a treatment that it takes about an hour of the patient's time. The treatment itself, it takes about 15 minutes. It's a treatment that it's a treatment performed in the office. We just need to get a little bit of blood from our patients, and then what we do is we numb up the nerves that provide sensation to the scalp. And after doing that, we process the blood, and then we go ahead and inject the PRP. You can also see, and this is another patient that we did the treatment, and we treated two specific areas for him. It was more about the frontal area and also the crown, the occipital area. So you can see the difference in thickness. And if you can go to the next one, you can see how the frontal area has a better thickness in the hair. The hair looks healthier and fuller. And if you go to the posterior aspect of it, the same concept about the helicopter that we were talking about, try to land a helicopter, and it's much easier to land it on the top picture because you have clearer spots. And that's exactly, it's not that we resolve the problem entirely, but it's a much, much better improved crown, and the patients are very, very thrilled with this results. And it practically, I mean, the only thing that it requires after having the procedure done is for you to go home, chill out for that night, and then keep up with your normal life the following day. It does not take any real true recovery time.
And how often could you have the PRP, or how often should you have it?
So the way the way that we recommend this treatment to be done is, we have two tracks. We have the regular track and the fast track. The regular track we inject, let's say today, and then after injecting you today, you will come back in 3 months and we will give you the second injection. We will take pictures, of course, the befores. We will take pictures in about 3 months when we do the second treatment, and then you will come back at 6 months and we will compare those pictures and consider another treatment. The reason why we wait for 3 months, it's because that's the natural cycle of the hair. That's how much time it takes for the hair to go in and out the different phases. And of course, we have like a nice diagrams and everything that I'm more than willing to share with our patients when they come to the consultation, but that's the scientific basis of why doing it every 3 months for the first 3 treatments. The accelerated track or the big boost is when we do it for 3 months in a row, today and 1 month, and then on the next month, and that gives you a nice good boost at the beginning. So for instance, in the picture that we have right now on our screens, this very nice patient, she wanted to do that fast track, and that's those are her pictures after the three month injections. And the male patient that we were sharing, he actually had the regular track, and that's after 2 injections, the results that he's getting. So we have those 2 options. And what we do is after 6 months, we always sit back, take pictures, and compare. At that point in time, we determine if we need to do the maintenance treatments every year or every 6 months. And really, a way of seeing this, and I like to share that with patients, is when you see this picture, is this worthwhile to you? Do you want to keep up having these results? Because patient always asks, do I have to keep on doing the treatments? In reality, there's a maintenance component of PRP, and that's true. But in reality, after they see and they look at those pictures, they say, you know what? Yeah, I really want to do some maintenance to keep up my hair looking healthier.
Does that, let's say if you're a guy, and does doing PRP help prevent any hair loss that you might be going to have anyway?
That's a great question, Monique. And the absolute answer to that is no, absolutely not. PRP does not prevent or stop hair loss. And it's important for patients to understand this concept, because hair loss, and again, I'm talking about in general terms, male, for instance, if you talk about male alopecia, you're going to see that the male baldness pattern is a continuous pattern that will unfortunately it cannot be stopped. But what we can do is we can actually try to, as I was saying at the beginning, make you look the best way that you can. And what PRP does, it does not stop the hair loss process, but what it would do is it would, as I was saying, the hair that you still have alive, but it's not actually growing at that time, we can wake up those follicles that are hibernating and recruit them so you can have a fuller. And what we talk about is normally 5 to 10% of the follicles of any patient right now are dormant. So those are the ones that we're targeting with that PRP. So we can get you 5 to 10% fuller hair. And the other thing is, as I was saying, is that the hair that you already have, that we can get it healthier, thicker, and with a better look. So all that overall is what provides the results that you were seeing on the screen. And but the hair falling process, we cannot. I mean, I would love to be able to say yes, but no, we cannot make it stop.
Okay, I think that's actually a really good segue to have me show the audience some of our smart graft patients, and maybe Dr. Salazar, as I'm sharing the screen, you can tell us what we're looking at.
Yeah, so that's another step in our line of treatment, as I was saying during our introduction. When we have certain areas that are areas of baldness, certain areas where recruiting some of the dormant follicles is not enough, or when we would like making the hair a little bit thicker would not solve the problem, then we have in our armamentarium hair transplantation. Hair transplantation is truly relocating hair from an area that is thicker and fuller to an area that it's either thinner or has zero hair. There's a trick over here that we use, and that trick is, if you have, just think about like a square inch that is really full of hair. In order for us to make that square inch look bald or look like it is losing hair actively, we have to take out more than 50% of the hair follicles in order for that square inch of scalp to look bald. On the other hand, if we want to do hair restoration, we only need to put in 50% or bring back the density up to 50% for the area to look normal. If you take that into account, together with the fact that we can take hair follicles from a large area and concentrate them in certain areas with hair transplantation, then that's how we can perform that that relocation of hair without making the areas where we borrow the hair bald. So we take area mainly from the back of the scalp, the areas of this occipital area, and you can see in the pictures how we are harvesting, and we select those hair follicles, and then we transplant those hair follicles in the areas of concern. And we use the smart graft technology, which you can see on the screen right there where the arrow is. And smart graft, it's a technology that's in the category of that's called follicular unit extraction. And what that is truly you go follicle by follicle, and you're harvesting those follicles. You're scooping them out very carefully, because regardless of how we think about hair is a living organ. Hair is imagine like a small kidney, a small heart, a small liver. It's an organ. Every single follicle is a small organ. So we harvest that small organ very carefully. And if you can see in your screens where those little blue windows are in the machine, those are that's where the hair is going to go and be stored at a specific temperature in a very well-controlled humidity environment. Kind of, and the analogy that I like to make is, you see on the news when they're talking about that, they show you that they're going to do a heart transplant or they did a kidney transplant, and you look at the team that's carrying, at the transplant team that's carrying the organ. The organ goes in a cooler under certain conditions, and that's exactly the way SmartGraft treats the follicles like true organs, and they're going to be stored in that machine during the harvesting time. Once we're done with that, we select them, as you can see in the picture, and the selection process is not only for picking out the best follicles, but also to categorize them. The ones that are singles, we want them to go at the front at the battle, right, to have a natural look. The ones that are doubles, they can go in the second row, and the ones that come in 3 and 4 follicles, they can go further back so they can give a better thickness. So that's what truly doing hair transplantation encompasses. And you can see some results over here on your screen where we're actually giving more fullness in the frontal area of the hair. And in his case, in this patient case, if you point out with your arrow behind the area that we treated, you can also see right there, and you compare it to the one before, we also did some PRP injections on him. So we did PRP and we did hair transplantation, and you can see the difference in thickness. Now, if you can go to the next slide, you're going to see a very, very natural look and how much thickness, and look at the color of the hair that also gets intensified with the PRP. Go to the next slide. And you can see that there's a very, very good change. Patients can appreciate that. Normally, what happens when we do hair transplantation is that let's say again, we do it today. By tomorrow, we'll see you in your follow-up visit. We change the dressings. You in terms of recovery, you're going to feel completely fine the next day. You just have to be careful with your new follicles for about 2 weeks. We'll tell you exactly how to shower and how to shampoo and when to do that. And then after those 2 weeks, you're going to start actually seeing the hair growing. And then what happens is that hair that we transplanted goes dormant and goes into hibernation. And it takes about 2 to 3 months for that new hair to start growing. And what you see on your screens are the pictures of this patient at about 6 months after the transplantation, once you start seeing the real result. So it takes a little bit of time and patience for the results to show, but they're 100% guaranteed. And you can see that there's an important difference, and the patient also is very, very satisfied with that result. Here's another case of a patient that wanted to have like a very, very conservative result. He wanted us to work on the just on the front. And one of the things is that hair is a commodity, and you have to treat hair as a commodity. And of course, when we do our hair transplantation, we establish the number of hairs that we're going to be repositioning or transplanting, and it depends. I mean, of course, as you can imagine, the more hairs that we are moving around, that affects the cost of the procedure. And sometimes patients approach it by saying, well, I only want to move this many hairs and try to give me the best result possible. So then we have to concentrate in specific areas of the scalp to try to give a much better look. Let's see the next picture. And you can see the pictures on the top are the before, the pictures on the bottom are the after. And this patient wanted to concentrate, and I think very, he wanted to concentrate on the anterior aspect, and I think that was a very wise decision. And as you can see, it looks like a much younger person. And sometimes I would say even patients, this is comparable to a facelift sometimes. The power that hair restoration has, and the fact that patients will go and see their friends and their family that they haven't seen for some time, and it's I don't know what's happening with you, but you look fresher, and that's what we like to hear from our patients. Are there any other questions over there, or and from the audience, or anything else that you want me to touch up on, Monique?
Yes, we do. Sorry, I had my mute on. I was talking. You just didn't know.
Oh, no.
Sorry. So one person asked, if I try to do hair care or the PRP injections first, will my hair transplant results be better?
I would say that's a very good question. I would say it's kind of, let me bring this analogy. It's one of those like think about body contouring in a patient that actually she comes and she wants to be evaluated for a tummy tuck, and she has like a little bit of extra fat, and she in the abdomen, and also some extra skin, and she wants to look better. And she asks, Dr. Salazar, if I lose a little bit of weight, do you think that will impact my overall result? And the answer to that is absolutely yes. And it'll be, and the best way to do it is why don't we start doing that first? And then we follow you, and then we plan our surgery. Definitely that'll be the best way to approach it. So that's why I truly invite patients that are interested to stop by and establish an appointment with us, so we can actually come up with a nice regimen, even if they feel or they're not sure if they're good candidates for hair transplantation, but just to start establishing a nice healthy regimen for their hair. And then maybe in the future they can consider that, or maybe they'll never become candidates for hair transplantation because they don't need it. But yeah, that's a good question, and I think that would be the appropriate order to do it. I'm gonna take a sip of water here.
Okay. One person asked, they said they had a facelift a few years ago, and there's some hair loss around the hairline that bothers them. It must be a woman, because she says, I've been able to wear my hair back.
Mhm.
Can you do transplants just to those areas?
That's another great question. Yes, that's a very good possibility, and actually, this is one of the most powerful areas in which smart graft can be used. Definitely, whenever we have any procedure, either it could be a facelift, it could be a brow lift, a coronal brow lift in which there's an incision up here. Also, there could be patients that had some sort of a I mean, think about like brain surgery or some sort of what we call, and I was struggling because I wanted to say the medical word. I want to say craniotomy. Whenever they have like any surgery that involves the cut in the scalp, that it's not uncommon that cut transects, affects the hair follicles. And then once everything heals, it heals like a nice white line, a decent or well-defined line, but there's alopecia on that line. And what we can do is we can actually go in and transplant those hair follicles, steal them from the back, and go in and place them right along that line so we can camouflage it better. And the natural question would be, but it is a scar. Will my hair grow through that scar? It will grow through that scar. The problem is not the scar. The problem is that when that surgery was performed, the hair follicles were injured. And it's something that you cannot avoid. I mean, you in a way you can, but overall, the absolute answer is you cannot avoid injuring those hair follicles. So once everything has healed, and if you think that those scars are noticeable, we can definitely help by doing some hair transplantation to those areas. Yes.
Oh, excellent. We have another question. Which supplements would be a good starting point before moving to PRP or grafting? Which is actually perfect for right now, since we can't do any PRP or grafting. They could start, using some supplements now, or some shampoo, or what would you recommend?
There are multiple products out there, and I mean what we have available for our patients are the ones that we know for sure that they work, and the ones we truly believe in, and you can find those in our website, and that is we have, oh, there you go, that's fantastic. We have Nutrafol. Those are the products that we like. We like Nutrafol Core for women and for men. And in terms of the female version, the for women, we have For Women Plus, which like it's before and after changes in life, and we have as well hair. Yeah, exactly. Those are going to be the vitamins those supplements ensure that you have every single micronutrient that your hair needs to grow healthy. And then you can see as well that we have a shampoo and we have a conditioner that are the two best options that you have for hair restoration. And actually, I believe, Monique, that we do have them available even right now, right? During this difficult times.
Yes.
Patients.
Yep. They can order, and we ship. Charity in our med spa will ship it out to you. So you can go to shop.ljcsc.com and go ahead and, put whatever in your cart.
Right.
And what would be, let me just ask you, because I don't know the answer. How do you decide between the Hair Restore shampoo and the professional strength? How do they know which might be a better option?
Well, it's one of those. It truly, the strength on the one that you're showing on your screen right now, it's greater, and I would say that's why it's important for patients to be evaluated by us. But the like general guideline for them is, if they think that their problem is very severe, to go with the black one. If they think that their problem is not that severe, to go with the red one. Let's just keep it that way, in a broad way, just for during this time. And then once they come here and we evaluate, then we can recommend them either or the other. But let's keep it broad like that. And Monique, the other thing I think it's important to talk to our patients about is once they're we're fulfilling all of their orders and everything, we follow the most strict protocols for hygiene, and all of our associates here in clinic, as we are getting all the orders, everybody wears a face mask, everybody wears protective gloves, and so your products will not going to be touched by bare human hands, correct?
Yes, that is correct. And I'm going to actually share now. So one thing I think it's important for everybody to know is that we are, it paused my share. There we go. Let's see, resume. Can you see my screen or no?
Absolutely, yes.
Okay, so I think for right now, it's really good for people to know that we do have virtual consultations. So Dr. Salazar could do a Zoom meeting. It's all, like we said, HIPAA compliant Zoom. We have a special version in the office. So, you could set up having your one-on-one free hair consultation, and he could really go into more specific for you what might be the best options, but certainly the products that we have online and the Nutrafol supplements are all perfectly safe to order now, but then really coming up with a plan with Dr. Salazar. So you can call or text us at 858-452-1981 or email us at lookgreat@ljcsc.com. And then if you want to be on our text list where you get little alerts if things are happening, for example, when we get to open again, whenever that might be, or any specials we have going on or any special events, you can text the word GLAM to 858-452-1981. And then where the shop was, again, is shop.ljcsc.com. So I'm going to stop sharing and go back to Dr. Salazar. And I think we hit all the questions from the audience. So I thank you very much. Any other words you want to tell everyone?
No, thank you so much, Monique, for this opportunity. It's fantastic, is that we really feel that we're still really close to our patients through this virtual consultations and this nice chats. And to tell our patients that as they can feel, because I'm pretty sure they can feel this, we over here at La Jolla Cosmetic Surgery Center, we're really passionate about what we do, and definitely hair restoration is one of the things that we really care about in our patients. So definitely for them to contact us, to dedicate some time to come and spend with us, and so we can chat and establish a very personalized a plan of care for their hair.
Wonderful. Well, thanks everybody for coming. We really appreciate it. And then tomorrow we have a live session with Amy, one of our estheticians, and she's going to be talking about what you can do now to prep your skin for a procedure once the quarantine is lifted. So what kind of products, thinking about prepping before either a surgical procedure or a laser treatment or thread lifts like we talked about with Con on Wednesday. And then as soon as this is over, I will compile the recording and then put it on our website, which is if you go to ljcsc.com/events, that's where you will see all the past recordings and upcoming sessions. So thank you all, and we will see you again later. Bye-bye.
Thank you so much.